Now, in our first story, the coalition of NGOs in health have expressed concern about the rate of spread of COVID-19 in Ghana after President Akufo-Addo revealed last night that one person was responsible for spreading the virus to about 533 others in a fish factory at Tema. Speaking on News Desk, President of the coalition, Gabriel Benaku, wants governments to enforce the social distancing protocol through legislation.
Those people affected and their families. So we think that if only that is the exact record, then it means that our treatment is not responding well.
And so you think that we should revise the treatment method, and especially I want you to look at this within the context that we have a lot of the cases being asymptomatic, and we are told by the Ghana Health Service that quite a number of them, significant number of these numbers or cases are being treated at home. Should we revise that? Should we have a case where every person who is infected would spend at least some minimum time at the treatment center?
You see, Ghana, we started doing well, and sometimes I have issues with the advisors to the president. Sometimes we are doing well, and before you realize, they give another strategy that try to undo all the gains we have made. If we had progressively done the partial lockdown, we would have stopped the virus by now. Now, when the president lifted the partial lockdown and instituted the state strategies, yeah, we lauded, but we said, if you notice, 3 weeks ago, we warned that then you need to double your investment and logistical support for the state strategy. And one of them is when you trace and test, or when you are tracing, you know human beings are lazy if you don't supervise. Then you leave people at their very home without putting in the proper mechanism. Then they have the opportunity to move around. So all that we need to do is we should review some of those protocols that are not working well. If people are at home and they are not working, let's compare scientifically. As government, let us believe that they are working within science. If they are working within science and data, what they need to do is that those who have quarantine, how fast are they responding to treatment? And those who are quarantined in their personal home, self-quarantine, how effective is that working? They need to show us the data to tell us that those who are self-quarantine, this is the rate of improvement. Those who are mandatory quarantine at the health facility, this is the improvement. And then we can move from there. Otherwise, it's not giving us a clear picture. Sometimes you get confused about how the whole thing is being managed. But it shouldn't be a case that the team is trying to keep some information to themselves and then try to let the public begin to wonder, and that can also cause the fear and panic as the people I'm talking about. So I think that let's review, they should provide statistics on those who have been home quarantined. How fast are they responding to treatment? And how are they responding to the guidelines at home? Vis-a-vis those who have been properly quarantined to provide treatment. How effective is that one, and how are they responding to treatment? And that record should be shown for every Ghanaian. And in fact, it should be published for just like what they are doing on the cases. If we do that, then we can all have that confidence in some of the strategies. But I do know that the best strategy for us to do is to restrict people when they are suspected.
Still on this story, Director of Institutional Care Division of the Ghana Health Service, Dr. Samuel Kaba, says home care is currently not an option for the treatment of COVID-19 patients. Speaking on News Desk, he revealed data available to the Ghana Health Service indicates patients on admission at the various treatment centers respond better to treatment as compared to those at home.
And let me say this. I do understand why so many people are worried about our recovery rate, but there are some few things we need to really understand, and everyone will be on the same page. One is the way we do the testing, which everybody now knows that when you get positive in Ghana confirmed, you have to wait for 14 days. Then after that, we do one test negative, then the second test. And until we get the 2 tests negative, we will not declare you recovered. Everybody knows that now,
yes.
Which I think is a good news, and I think it's a standard we want to establish, and based on the advice and from WHO and other countries that are also doing that. Now, the second thing is this.
Before you move on, Dr. Kaba, just some quick information on that. When you test negative for the first time, how long does it take to have the second test done?
Here's the point. You stay with us for 14 days.
14
days.
So
the 14, we do the first test.
Okay.
If it's negative, 24 hours later, we do the next test because it's a serial thing.
There you are.
So you do one on the 14th. If it's negative, the next day, 15th, we do the next one, right? There should be 24 hours. It's a serial thing. So, and that is exactly where I want us to all go to, and so that people will be very calm when it comes to recovery. I'll use a typical example, like what happened with the latest cases that we've been able to confirm, the 500 and over cases.
Yes.
Now, those 500 and over cases, none of them will be declared negative until minimum the next 17 days, which means that they will be kept for 14 days. The 14 will do one test, the 15 will do the next. So let's say we receive the results by the 16th and the 17th before we can say they are recovered, which also means that we have to be patient and wait till at least a minimum. Anytime someone is confirmed, at least we have a minimum of 16 days to say the person has recovered, because when you consider the test done. So if we are expecting that these 500 people will contribute directly into our recovery within the next 1 week, it might not be so. So people need to understand that time frame that we keep the people. COVID is one of the things that requires a lot of patience when it comes to treatment and recovery using this kind of standard. So until the next 14, 15, 16 days time, we will not be talking of recovery of those people. So they will be contributing less. So although our figure is not rising, there will be a day that if we have isolated, I'm just giving an example, if we isolate 100 people today as I talk to you, the same day, those 100 people that we isolate this very day, until 14 days time when we do the first test, then 15 days we do the next test, that which means we will get the results on the 16th, because 14th you get the result 15th, 15th you get the result 16th, right? Let's say if it's all things being equal, no delays. Then it means that we shouldn't be expecting these people to contribute to recoveries until this time period.
Meanwhile, the Ghana Health Service is expected to announce a strategy to deal with the surge and fast spread of the virus in Tema.